Patients, family, and friends can sometimes come to the clinic visits with the patients to listen to the physician that's speaking with the patient, specifically what sorts of advice the physician has to give to that particular patient. And then that way, when they get home or they get to the patient's own environment, they can help the patient implement those changes and those plans that the physician has asked to implement. The other thing that family and friends can do is exercising with the patient, right? So if the patient wants to take a walk to help them exercise, or even the family member or friend can say, why don't we go take a walk? Because you know that that's one of the plans that the physician has implemented with them. Then it's easier for the patient to be motivated to exercise more when they have family and friends wanting to do it with them. Another thing that the family members can do is work with the patient to pick healthier diets. If the family and friends are eating poor diets, then it's easier for the patient to relapse and want to eat those poor diets as well. But if everybody around them is eating a healthy diet and they're encouraging the patient at the same time to make those healthy changes and eating with the patient those healthy diets, then it's easier for the patient to be more compliant with eating the healthier diet. I think that anything that works, as long as aerobic exercise is good. Some patients love to swim. It's an excellent form of exercise. I think an easy one that everybody has access to is walking. So walking, it has to be a brisk walk, walking to the point where you cannot sing, or you can go based on your heart rate, right? So maximum heart rate is 220 minus age. That's maximum heart rate. And you can start off with 50% of that maximum heart rate and then work your way up to about 75 to 85% of that maximum heart rate each time you exercise. So the point being that the goal is, if you decided to walk, you get yourself up to that 50% to 85% of the maximum heart rate, stay there for about 30 minutes and then ramp down the exercise. Or even more, if you want to exercise more, you can do more than 30 minutes, 45 minutes, an hour, whatever works for the patient. But that's a good way to set a goal. But in terms of the form of exercise, I think as long as it's aerobic, some people like to dance. Dancing is good too, as long as you're able to raise your heart rate doing that. It's a matter of what works for the patient.